everyone, and welcome to the Women's Wellness Lounge. Of course, you know I'm your host, Delana Watkins, and we are still hosting our On the Road series for the month of May and part of June. So I am here with another amazing special guest. I'm here in her clinic, and her name is Starlene McKelvin. And I want her to tell you a little bit about herself and about what she does. And we're going to kind of have a little bit of dialogue back and forth. So first of all, I absolutely love her space. It is very warm and inviting. And of course, that to me is like the first sign to say, you know what, come on in. Let's see what we've got going on. Everyone, I don't care for the aesthetics of having a place to feel stuffy and to feel like I'm walking into a hospital room or a medical situation, right?
Yes.
So, Starlene, tell us a little bit about you and what you do here in New Destiny.
All right. Well, my name is Starlene McKelvin, and I became a registered nurse back in 1988. So pretty much I have worked as a nurse for many, many years.
Right.
And most importantly, I became a nurse practitioner in 2009. And my area of expertise is pretty much I do primary care services.
Okay.
Also, I do weight loss services. We do medical cannabis evaluations, certifications, and also we're out here trying to help with this opioid epidemic.
Absolutely. All of those areas. Just as I'm hearing you say what it is that you do, it's like, yep, that's needed. Definitely that's needed. First of all, let me back up because I didn't ask or I didn't say in my intro where she was located. So let's tell the viewers where you're located.
Okay.
So
and even before I even do that, I want to thank you so much for coming out doing this interview.
Sure, absolutely. I love it. Look, not only does it get me out the house, but then I'm able to finally see where people actually, do their services because we talk and you and I have been, associated with one another as friends for a number of years. But I've never stopped long enough to actually come out and visit you. It just gives me an excuse to come and see your space and actually see what you do.
Yes. We've been here since 2018. We opened our clinic March the 10th, 2018. And the name of the clinic is New Destiny Health Services. I work here with my daughter. Her name is Destiny. And she was the person that kind of motivated me to have my own clinic, to promote health and wellness.
Okay.
So like I said, we've been here since 2018. Our location is 4801 Liberty Heights Avenue. And we're inside of the Forest Park Senior Center. You walk in, we're like the fourth door on the left.
Okay,
so
I love it. It was very easy to find.
Right.
Just getting here, kind of parked. I came and I was like, oh, and it's so funny because I go up and down Liberty Road all the time, and of course, unless you're going somewhere for a specific destination, I didn't. So when I drove by, I was like, oh, that's it. I know exactly where it is. So convenient, easy to get to, right off the Beltway, right off the Liberty Road, and like she said, it's in here inside of the Forest Park Senior Center, and you come in. And not only is, of course, everybody that was very welcoming as I walked in through the door. So come in, and here you are in this gem of a area back here for your clinic.
So we really love being here. It is my passion to be able to improve the health literacy in our community.
Now you're talking my language.
I just want to educate people on just lifestyle modifications, simple things that you can do to maintain your health and your wellness. So we do a lot of education here, educating women about the importance of maintaining compliance with their health care screenings.
Now y'all see why I'm here interviewing her, right? She's talking my language. Like all of this is what I enjoy and what I love doing and what we truly focus on.
And it's just so rewarding just to be able to help people to live at the highest level of health. Just to see people come in, they on a bunch of medications, they have multiple medical problems, and as we focus on the obesity, a lot of times we can mitigate a lot of the chronic illnesses that they're dealing with. So we love it, the wellness services and the weight loss services. I think that's probably my passion. That's something that I love, and I don't even look at it as a job.
Because you're able to just do it. That's like with me, like when you find that thing, and we talk about this all the time, that you would do for free. Everybody's seen that, heard that, read about it. When you find that thing that you could do for free, that you would do for free, rather, I'm going to say that you do for free, that you wouldn't mind doing for free. That's when you know that you have struck gold and you've really found your passion, right? You wake up thinking about it, you go to sleep thinking about it. It's something that you do all throughout the day.
Yeah.
So that was my next question for you, but you've already answered it. It was going to be, out of the things that you listed, between the cannabis and the substance abuse and, you know, the weight loss, it sounds like education is obviously at the paramount of what it is that you enjoy doing.
Yes.
So now talk to us about the medical weight loss that you provide. What does that look like? Somebody calls you up and says, I want a consultation. I want to come in and discuss what my options are to getting on a weight loss journey. And then what do you guys do?
So pretty much what you have to do, we definitely ask everybody to get routine blood work done.
Okay.
Now, if you have a primary care doctor and you've had blood work done within the last 6 months, we'll take that, we'll review that, but then they give me an overall idea of what's going on, what you're facing medically.
Okay.
So that's important to have the lab work done. Once the lab work done, you'll come in for your initial consultation, and that's where we'll do all of your body measurements, we'll get your weight, we'll check your vital signs, any health problems that you have, we'll review any health problems, and then give you strategies on how to manage those health problems. And then we talk about your options. We talk about pretty much everybody is coached on just eating healthy. We kind of recommend a plant-based diet because research really has shown that a plant-based diet has the ability to reverse diabetes even after you've had it for a long, long time. It can really reverse diabetes. It can reverse heart disease, but we realize the average person really cannot maintain the discipline of a plant-based diet.
But however, we still can coach them and educate them because, you know, I'm a big proponent of the plant-based diet. And again, it's the 80-20. So let's say you want to make that shift and that change. If 80% of your diet is kind of foundationally around that plant-based, you will still see a significant change in your, you know, chronic illnesses, even your weight loss. Because I always say weight loss is a side effect of having a healthy lifestyle. Period. Like everything you do should be on the basis of having a healthy lifestyle. So
I kind of love that. I love that, and I do. I definitely preach that as well. You're not going to be 100% perfect with that particular diet. But as the majority of the time, 80% of the time, if you can maintain a diet like that, you can do so much to improve your overall health.
So and it begins to shift your mindset around the choices that you make, right? And so I always say that our choices are sustainable when we know why we're doing it.
Exactly.
So the education mirrored with the action, then it becomes a habit.
Exactly.
So, you know, I don't want people out there. What I always say to them, so it's not that we're trying to shift what you're doing for the short term. It's a lifestyle that we want you to understand and gain for the long term, for the long haul, for the journey.
And we most definitely educate that this is not any kind of diet. This is just a choice to be able to maintain a healthy lifestyle. This is a lifestyle where we're eating healthy, we're moving our bodies most days of the week for 30 to 40 minutes.
We're sleeping better, we're stressing less.
We like I said, most of my time, majority of my time is really spent educating patients on things you can do just to adopt a healthy lifestyle.
Wonderful.
Mostly cutting back on things that's going to harm your health, like alcohol and nicotine and fried foods and a whole bunch of sugar, processed foods. So it's something that can be done. But you have to have that mindset change, and you have to be really intentional.
And that comes from pinpointing your why. Right? So I know during the first part of why you're here, are you here because, you know, you had a health scare? Are you here because you realize that you've kind of are at the upper end of the heaviest you've ever been? Are you here because you've actually you're tired of starting and stopping, right? So you have to go back to the why, and that typically will tell you those people that will actually stick with it. Don't do it because you've got this 10-year anniversary coming up or this, you know, class reunion coming up, because to me those are short instances of habitual thing or habit forming things that you won't be able to sustain because you're doing it for a reason connected to an outcome, right? That's short term. So it's connecting it to the long-term why.
And that is so important, understanding your why. And having that why in front of you will just keep you motivated. And I let people know, don't feel bad. Sometimes you may have a bad day, maybe you'll go to a celebration and you may have sugar. It's fine. Every day is a brand new day to start over again on your lifelong healthy journey. It's a journey. It's a journey.
Exactly. So one day at a time.
One day at a time.
All right, so now all that sounds good, right? So y'all out there probably like, we heard all that before.
Yeah.
So okay, what are we gonna do?
Yeah, and so the thing that I wanted to talk about is that I used to prescribe medications like Topamax and phentermine to kind of suppress the appetite, but those medications, in my opinion, they have a lot of side effects.
Yes. Yeah, that's what I was going to say.
And it's just you don't have really good long-term benefits from those medications.
Okay.
So recently, I started using a medication called Ozempic.
Okay.
And that's a medication that is approved by the FDA for weight loss, and it was originally approved mostly for type 2 diabetes.
Yes, and you guys have probably seen the
commercials. They have so many
commercials.
And what I can tell you is that I really need to get the word out about the significance of Ozempic and how it can positively affect your diabetes.
Okay.
And I learned about it through personal experience. I have a really close friend who ended up with diabetes, and she's a nurse practitioner too. She ignored it for years and years. I guess she was in denial, thinking if she did not address it, maybe it would go away.
Say that again?
Yeah, if she did not address it, I believe she assumed
that it would go away.
And we're talking about a family nurse practitioner. She was diagnosed with type 2 diabetes, and she ignored it for like 4 or 5 years.
So I know that I have some viewers out there that can relate to that, either we're speaking to what is something that you've done before, or a family member, a friend, or a girlfriend, co-worker, someone at your church who is diagnosed with diabetes, type 2 diabetes, and either is not properly managing it or won't even really embrace the fact that they do have type 2 diabetes.
Yes.
So now tell me what it is that your friend did. What did she do and how did you
and so anyway, she started having symptoms of diabetes. She started having neuropathy. She started having numbness and tingling. And she says, this is not normal. So because she was symptomatic, she ended up seeing her doctor saying, look, I really want to manage this.
Right.
And so she ended up going on diabetic pills for a little while. After about a year or so, she was started on Ozempic. And so when she started her diabetes journey, she had a hemoglobin A1C in the 12s. And hemoglobin A1C gives you an idea of how well you're managing your diabetes.
Right.
And American Diabetes Association usually recommends for your hemoglobin A1C to be below 7%.
Did you hear that?
They wanted
recommendation
7%.
And hers was 12.
Hers was 12. It was actually 11.2. It was so she said 11.2, and I'm symptomatic. So anyway, she started taking a diabetic medication. She maintained her compliance. But the thing that really helped her is she started Ozempic. It's a weekly injection of Ozempic. Okay. And after being on it for about a year or so, her hemoglobin A1C went from 11.2 down to 6.2. And then she lost about 50 pounds.
Okay.
So I saw her weight loss, and I said, okay, maybe I can use some Ozempic for weight loss. So I started using it, and I'm telling you, it's amazing how people have amazing success.
Right.
They tend to come back. They see me initially for the consultation. We do the first injection in the office, and then that one pen is good for a 6-week supply. Okay, so they'll come back and see. That one pen is good, and we do I'll show you how to do your injection. We do that right here in the office.
Right. Okay.
And that one pen that you get initially, normally I supply you with your first 1 month supply. Okay. And that one pen is good for 6 weeks.
Got it.
And so then they come back to see me for 6 weeks. And mostly the weight loss is around 10 to 15 pounds after 6 weeks.
Right, okay.
Your weight loss is like 10 to 15 pounds.
Right. If they're in compliance.
If they, and most people, it's kind of easy to be compliant. Yeah. Because when you're on Ozempic, it really suppresses your appetite. Right. Okay. You have this sense of being, what it does is it slows your gastric emptying. Okay. So it tells the brain that, hey, I'm full, which means you're not going to eat as much. If you're not eating as much, you're definitely going to lose weight. So it's easy to be compliant because it definitely significantly decreases your appetite and the amount of food that you're eating each day. Right. Now it does have now the Ozempic, I can tell you for a fact, it does have side effects. And so what they've done with Ozempic, they're really smart. When you start off initially, you start off at half the maintenance dose.
Okay.
Your maintenance dose, just to build up your tolerance. So your maintenance dose is 0.5, but your first 6 weeks you only take half that dose.
Okay.
To give your body time to get adjusted to mitigate some of those side effects.
Which are more GI related. I think you were explaining to me. So when we talk side effects again, it's typically when you have and really, I wouldn't even term that's more like
an adverse reaction.
It's
like an adverse reaction. It's an adverse reaction. It's definitely related to your Ozempic.
To the Ozempic, yeah.
You can have a little bit of nausea, a little bit of vomiting. I have not had anybody complain of diarrhea, but I've had people complain of constipation.
Okay.
Because it slows gastric emptying.
It slows down. So then that makes sense.
That makes sense.
Because you're slowing down the gastric emptying.
So all that, how to be able to manage that is fairly easy. It's just a matter of increasing your water intake, increasing your vegetable intake, increasing your fiber intake.
Right.
And
that should keep things flowing, okay? Which is what you're supposed to be doing anyway. So if you're eating well on that end and you're taking in your fresh fruits and vegetables and the proper amount of water, it should hopefully mitigate the constipation that you're in. Now, when they come back for the 6 week, what lab work are you?
Well, initially we do lab work just once a year. Okay. So initially, when you come in, we want to see what your hemoglobin A1C is. We want to see if you have diabetes, and how bad it is, the level of acuity of your diabetes. We check and make sure your thyroid level is working fine. Sometimes if you have a low thyroid function, it will cause you to hold on to extra weight. So we want to make sure that thyroid level is functioning fine. Absolutely. We want to make sure you're not anemic, so we do a CBC. We want to make sure all your electrolytes and minerals are within normal limits. So we do a CBC as well. So we do a CBC, we check your electrolytes, minerals, your thyroid level, your hemoglobin A1C, and we also check your cholesterol level. Okay. So that kind of guides.
So that gives you a nice open view into kind of what's going on before you even.
And so most people, they will get their lab work done here. Some people already have lab work done with their primary care physician, and will accept that as well. So that kind of guides my care. Looking at their lab work.
Okay. Now, while you're on Ozempic, since it is typically prescribed for diabetes, even though you can, like you said, on label or off label use it for weight loss, are you checking their, do they have to do a glucose check with it? Or
no, you don't. Only if they have diabetes and it's
then you would just do your regular.
Yeah, they do regular checks, whatever's recommended by their primary care physician.
Okay, but nothing extra.
Nothing extra. Yeah. So that's perfect. And the most important thing, it will if you have diabetes, it will really regulate your glucose levels, because of course when you lose weight, you're more sensitive to insulin, which helps you to be able to utilize that glucose. So it really helps to maintain stable diabetes and good blood glucose control.
Absolutely, I like that. Yeah, that's the main thing, because that's a good. So now you're getting 2 for 1.
Exactly, 2 for 1. You're managing your glucose level, you're managing your diabetes, and you're getting at a healthy weight.
Right. Okay.
So that can cut back on a lot of complications. Your complications to obesity. Related to obesity.
Listen, that right there is amazing. Now, give me, since you've been doing this for a little bit, and I know you were telling me, give me 1 or 2 success stories of people that have lost weight and kind of where they are. Like, let's take your worst case scenario, or somebody who was was a brittle diabetic maybe and came in and then lost weight.
We had one patient, and she was in her 30s. Okay. She had really brittle diabetes. Okay. Had complications, had some kidney problems, some eye problems. Oh, wow. And so she was on medications for diabetes. I believe she was on metformin. She was even on insulin as well. So she was really trying to manage that diabetes.
You got the oral hypoglycemia going on
and she came in and started Ozempic, and she was so proud. She did so well. She was able to lower her hemoglobin A1C to a normal range. She was able to lose 20 or 30 pounds. She did really well for a very long time. That's good. So she was definitely a success story. Okay. And but she ended up having to stop Ozempic, because she's young too, in her 30s, and she was diagnosed with breast cancer.
Oh,
So now she's presently in the process of being treated for
Okay.
breast cancer.
Okay.
So she said once that's all stable, she'll come back and see
Right,
me.
yeah.
But she did really
She did
well.
good leading up
She
to,
did.
and let's just put a
Yes.
pin in it and make a point there.
Yeah.
That because she was able to get her diabetes under control,
Yes.
because she was able to lose weight, being
Yes.
diagnosed with something like that put her body in a more healthier state to deal with that. So,
Yes.
ladies, do you not see the significance and the importance of maintaining your weight, being healthy when we are, of course, unknowingly faced with dealing with a illness such as that?
That is so.
So had
such a
she
great
gone
point.
into it with the brittle diabetes, being on, the oral
Yes.
hypoglycemic, the
Yes.
insulin, 30 or so pounds heavier
Yes.
going into that, right?
Yes,
So
yes, that is
that's
such
yeah.
a good point.
Mhm.
She was at a much better state to be able to deal with all of the therapies related to breast cancer because she had that diabetes under control.
Absolutely.
So that's one success story.
Okay.
And then I can give you my story.
Oh yeah. Okay.
Yeah,
See,
I can give you
she
my
was
story.
listen, y'all. She was a test of the test, right?
Yeah.
Y'all know how I am. Like when I try something new or do something, I'm
Yeah.
always like, hold on, let me try that on myself first. Let me at least see if it works. Or do
Yes.
beta testing, right?
Yeah.
So if it's not something that I can benefit from, I'll do like a beta test. So Starlene was her own beta test.
Exactly.
So tell us what your
Yes.
results and outcomes
Yes.
was.
And I was so excited because my friend was telling me about those Ozempic.
Uh-huh.
And I said, well, I don't think my doctor will prescribe it for me because I don't have diabetes.
Mhm.
Well, I have a nurse practitioner. And he said, sure, if you want to try it, I'll go ahead, I'll prescribe it for you.
Right.
And so my normal weight should be around like 140, 150. I ended up being on medications that ended up ballooning up to 194 pounds.
Wow.
I was 190. I could not get that weight off. I was
Yeah.
exercising up, down.
Well, over 40, what happens,
Yeah,
right?
the
We're in that
metabolism.
and we're in that perimenopause,
Oh,
menopause.
honey.
So that's another whole layer on top of that
That's
as well.
That's a whole
That's
other
a whole
podcast.
top-
That's another
Yeah, I was
podcast.
getting ready to say, y'all, we're not going to go there. They know I would go there with that whole, we're not going to do that in
Yes.
this discussion. But yes, that is part of the contributory factors to that as well.
Yes,
So,
ma'am. So I really was struggling with my weight, my energy level, everything was impacted by the fact that I was overweight. So I started my Ozempic. I started like everybody else, 0.25. And in about maybe 6 or 7 months, I went from 194 and now I'm down to like 149 pounds.
wow.
So, and I've been able to maintain it. And as a matter of fact, now that I'm at my goal weight, it's possible now I'm on a sub-therapeutic dose,
Okay.
0.25. And instead of doing it on a weekly basis, I do it every other week.
Okay. So then you're able to kind of wean. Because I was going to ask, what does that look like for the long term? Can you kind of, maintenance dose it down? Can you take yourself off and just continue to do what you were normally doing since you were, okay.
Yeah. So you really can wean off of it altogether, or you can just lower your dose to the sub-therapeutic dose, and then you can do it once a month. So it kind of depends.
Right.
Everything is kind of individualized.
Exactly. I was going to say, I'm
It's
very particular about
It's
individualizing it.
individualized.
Yeah.
And so my doctor says, well, you're at your goal weight. I don't really want you on that maintenance dose.
Yeah.
And I don't want you taking it every week. So now I'm doing the sub-therapeutic dose, 0.25. And I'm doing really well. I'm doing really well.
Okay.
So I'm a proponent of it. I'm a proponent of Ozempic.
Right. I love it.
Yes.
Okay.
Yeah.
So, good. So, if you guys have any questions, I know we're kind of just, I get all excited when I do my interviews, whether we're doing them virtually or if I'm in person, if we're live. I get into the discussion because you all know that I'm very passionate about health and wellness and obviously, weight loss and just really impacting our health for the long-term journey. So if you have any questions, make sure you type them in the chat box. We'll be sure to answer those questions and get back to you as it relates to your concern or whatever your question is. But Starlene, thank you so much. Is there anything else that we did not cover? I know that we primarily focused on the medical weight loss, but I also know that there's other various services that you offer. It's Mental Health Awareness Month, so I'm big on talking, about that and just different services that you offer. And I guess one of the ones that we can loop into it would be the opioid and substance abuse that you talk about. There's some people that oftentimes will use those type of illicit drugs or narcotics to mask pain.
Yeah, that's true.
So that's something that you can offer too as well, is part of your services that you do here.
Yeah,
so tell us a little bit about that.
Yeah. We definitely offer those type of services.
Mm-hmm.
Right now we have an opioid and heroin epidemic.
Yeah.
People are dying with overdoses at really high alarming rates.
Mm-hmm.
So we really want to be able to impact and be able to help that community.
Right.
So there are medications that you can use to decrease your cravings for opioids, for heroin. It also will decrease your any kind of withdrawal symptoms
Right.
too.
That's a huge thing.
Yeah. So really, we've been able to make a major impact. The patients that we serve have been able to be free from illicit drugs for many, many years. And the main medication that we use here is two medications that we use. We use Vivitrol, which is an IM injection. And it's mainly for if you have alcohol use disorder, any kind of alcoholism. It's a monthly injection of Vivitrol that we can prescribe for patients. We've had great success with that. And then the main medication that we use that's helping so many people maintain a successful recovery is called Suboxone.
Suboxone. That's the one I'm more familiar with. And probably most of our viewers are as well. So
and some people are really familiar with methadone.
Yeah.
But the methadone is more restricted, where you have to go to a methadone clinic. You got to go on a daily basis. Where Suboxone, as long as you're really serious about your recovery, your urine drug screens are clean of any kind of illicit drugs. You can get most of my patients, the ones that I have on Suboxone, they come once a month. Their prescriptions sent to the pharmacy, and they come and see me on a monthly basis. And they've been able to get off of the drugs, get off the fentanyl, and been able to maintain a successful recovery. So we definitely plan on expanding those services to be able to help more and more people.
Yeah, especially since you're seeing, like you said, such a positive.
Oh yes. And I thank God. I have, like I said, all of my patients, I don't have any problems at all. Their urine drug screens are negative. They come and they see me. I check their vital signs. I educate, of course, any medical problems that they have. I educate them on how to manage those medical problems. Talk to them about the importance of seeing their primary care physician. But I'm pretty much an addiction specialist. They mainly come to see me just for that.
Yeah.
And so they come in, do their urine drug screens, get their prescription, and then I see them once a month.
Right. I love it.
So I love that.
Yeah. Especially, like I said, just kind of dovetailing that on it being mental health awareness, because oftentimes that is sometimes what people tend to kind of go to.
You are so right. I have one patient, and that's what she struggled with. Her daughter passed away. She ended up with depression. And she had been heroin free for many, many years. Had a relapse. Had a relapse where she started using heroin again, and was able to come and see us. We also talked to her about the importance of going for a support group. She started going to Roberta's house, and she joined a grieving support group. That made a major impact.
Because it was a change in life condition that kind of set her back. It was a trigger for her.
It was
put her in a deep depression, and what she knew helped to mask her before. And then there's just some people that just go to it that may not even realize that they're drinking, right? Especially as women. I had a girlfriend who didn't realize that her increase in wine, she thought it was a social thing, or that it was cute to drink wine the way that she was. And I just noticed that her wine consumption was through the roof. And I'm like, do you realize, I think you know, and so we kind of talked it through. And sure enough, there were issues that she wasn't dealing with. She was getting ready to go through a divorce. There was a separation, the drinking increased, and then the divorce happened, and the drinking went through the roof. And so we were able to get her into a divorce support group, you know, so that she could talk about what she was feeling, things that she probably wasn't able to express, and instead she was suppressing them with the drinking. So definitely.
Well, she was able to get out of that depression without going on any medications.
That's awesome.
Just as one support group, and they, matter of fact, they met through Zoom. It was during the middle of the pandemic. So they were weekly Zoom meetings, and she is doing so. I'm so proud of her.
That's awesome.
So now, and then the nice thing about Suboxone, once you're stable and once all of your wounds are completely healed, you really can taper off of that medication. That's what we're talking about now. She really want to taper off of it. Because she's retired.
Because she's addressed all the things that led to that. So she's able to kind of.
So once the wounds are healed, you don't have to be on it for the rest of your life. When you're ready and we come to have that consultation, we can definitely get you tapered off of it as well.
Good. All right. Well, this has been amazing. Listen, we are right at the closing time. You know, whenever I have my live show. If I'm here now, I'm, like I said, doing these out in the community, visits to various wellness centers. The time always goes by so fast when I'm talking about things that I enjoy. So, Starlene, please let the viewers and listeners know, because this is, of course, something that I always have on my Wellness Lounge show as well as our podcast. So we have viewers and listeners. So let us know where we can get in touch with you so we can learn more, because we only just scratched the surface about what she's doing here in her amazing clinic at the New Destiny Health Services Clinic. So let us know how we can follow you on social media, what your name is on social media, because you don't have, do you have a website or?
Yeah, we do have a Facebook page.
Okay.
It's New Destiny Health.
Okay,
It's
New Destiny Health. So New Destiny Health, and I'll make sure that that is put in the description as well, so that they can easily find you there.
Yes,
and then of course, Starlene McKelvin is her Facebook name, so you guys can definitely look her up there and send her any messages that you may have. Also, put it below this video or via email. Do you guys have an email as well?
Yes, it's New Destiny Health Services at gmail.com.
Okay.
The name of the clinic, New Destiny Health Services at gmail.com.
Perfect. Yep, and I'll put that in the description as well, so you guys will have that link should you need to send her a message. So this has been amazing.
Thank you so much.
It
was so nice chatting with you.
Yes.
It was really nice.
It's always good when like I said, when you have this passion and you just love what you do. There is no work. We just enjoy it. So until next time, guys, my next stop, I'll see you next Wednesday. And I haven't been telling you guys where I'm going because I wanted to at least give you some bit of a surprise when I pop up and show up in the community. So I'll see you guys next Wednesday. Make sure you're following me on Women's Wellness Lounge page on Facebook. Visit womenswellnesslounge.org to support our nonprofit, where we help women and girls get on a healthy journey. We help them to bridge the gap between healthcare and healthy living. Again, I am your host, Delana Watkins, and I'll see you guys later.